Imagine walking into a modern hospital and getting treated like it's 1825. Sounds insane, right? Well, some of the most brutal, outdated, and downright disturbing medical procedures are still being used today. And no, this isn't a horror story. It's real. Let's start with something most people assume died out with medieval medicine: bloodletting. Back then, barbers, yes, barbers, would slice open your veins to balance your humors. But while the straight razor's gone, the leeches are still very much alive. Today, it's called hemorrhoid, and it's a legit medical practice. Surgeons use leeches to reduce blood congestion in reattached fingers, ears, or skin flaps, because sometimes the blood flows in but won't flow out, and tissue can die without drainage. Leeches solve that by pulling blood steadily for hours. Even after they drop off, the wound keeps bleeding, which is exactly what doctors want. Their saliva isn't just gross, it's loaded with bioactive compounds. Hemorrhoid, a natural blood thinner, bedelins, which reduce inflammation, and enzymes that help everything spread through the tissue. And here's the kicker. In 2004, the FDA officially approved leeches as a medical device. They're bred in labs, packaged like meds, and used in top hospitals. So yeah, modern medicine still relies on a creature that was popular during the Black Death. Creepy? Definitely. Effective? Surprisingly. If leeches didn't unsettle you, maybe this will. We still zap brains with electricity. It's used for severe treatment-resistant depression, bipolar disorder, and catatonia when therapy and medication fail. In some cases, ECT is life-saving, especially when someone is suicidal and nothing else works. And it works fast. Antidepressants can take weeks. ECT can turn someone around in days. Some patients call it a reset button for the brain. So yeah, we don't call it barbaric anymore, you call it effective. Still, it's your brain, and they're still sending volts through it. With paddles, like you're a broken appliance. Next up, trepanation, or as it was once known, the DIY headache cure. Trepanation is one of the oldest surgical procedures on record, dating back to as early as 7000 BCE. That's before the invention of the wheel. Archaeologists have found thousands of ancient skulls with smooth, healed holes, meaning patients actually survived this. But why drill a hole in someone's skull? In ancient times, it was to release evil spirits causing seizures, headaches, or insanity. Basically, early neurology meets exorcism. Fast forward to today, and believe it or not, we still do it. Only now it's called a craniotomy or burr hole procedure, and it's incredibly precise. In modern neurosurgery, small holes are drilled into the skull to relieve intracranial pressure after head trauma, or to provide access for deep brain stimulation used in treating Parkinson's, epilepsy, or severe depression. Of course, now it's done with CT scans, lasers, and sterile drills, not rusty bronze tools. But the goal? Still the same. Open the skull to fix what's broken inside. This one's for the guys. We've mapped the human genome, landed robots on Mars, built AI that can do brain surgery. But your prostate still gets checked the old-fashioned way. It's called the digital rectal exam. And no, digital doesn't mean high-tech. It means finger. A gloved, lubricated, gently inserted finger. Sounds medieval, but it's still one of the most effective early screening tools for prostate cancer. The doctor checks for size, symmetry, and lumps. It only takes 10 seconds, but it can spot tumors before they show up in blood tests. Yes, there are PSA tests, a blood test that measures prostate-specific antigen. And yes, there's MRI imaging and transrectal ultrasound. But here's the kicker. None of them can fully replace a trained finger. In fact, some aggressive prostate cancers don't elevate PSA at all, meaning the DRE might catch what machines miss. And here's the weird twist. The DRE isn't just diagnostic. In some cases, it can be therapeutic. Stimulating the prostate can relieve swelling or help empty it in infections. That's right, the finger heals too. So yeah, some traditions die hard. Others go deeper. Not every outdated medical practice is gory or dramatic. Some are just humiliating. Let's talk about the metal bedpan, that cold, clunky symbol of helplessness. Invented over a century ago and somehow still standard in hospitals around the world. Why? Because plastic ones break and disposable ones, not eco-friendly. They're awkward, uncomfortable, and if you've ever used one, you know the sound they make is not discreet. And then there's the ancient hero of sterilization, boiling water. While most hospitals today use high-tech autoclaves, basically pressure cookers on steroids, rural clinics, field hospitals, and emergency tents, they're still boiling scalpels on camp stoves. Speaking of awkward, in some settings, rectal thermometers are still considered the gold standard, especially for infants, unconscious patients, or people who can't cooperate. Yes, they're more accurate. And yes, they're still used in some hospitals, mostly because old habits die hard and new ones are expensive. So for all the robotic surgeries and gene therapies, some medical relics just never left the building, probably gathering dust in that supply closet labeled, just in case. All right, here's one that sounds like a horror story, but a part of it still echoes in today's medicine: the lobotomy. Back in the mid-1900s, doctors tried to fix mental illness by stabbing an ice pick through the eye socket and jabbing around the brain's frontal lobes. It was brutal, crude, and often turned patients into emotionless shells. Definitely not the miracle cure they hoped for. But here's the twist. The core idea, intervening directly in the brain to treat mental disorders, didn't disappear. Today, lobotomies are outlawed, of course, but deep brain stimulation is a thing. It's a high-tech cousin that uses electrodes implanted deep in the brain to calm symptoms of Parkinson's, OCD, and depression. So the blunt ice pick got swapped for precision tools, but the idea of brain surgery as treatment? Still alive and kicking. Proof that some old medical ideas evolve, while others get stuck somewhere between radical and medieval. Haha. And just for fun, let's take a lightning tour through a few lesser-known procedures that somehow never got the memo that it's not 1860 anymore. First up, rubber band ligation for hemorrhoids. Sounds harmless until you realize what it actually is. They literally place a rubber band at the base of the hemorrhoid, cutting off its blood supply. It withers, it dies, it falls off. Like a medieval execution, but for your butt. Tonsil clamps. Some ENT tools still in use today trace their designs directly back to the 1800s and barely changed. Instead of yanking them out with bare hands like in the Civil War, we just use sleeker metal. The core technique, pretty much the same. And then there's the one that haunts every hospital patient, bladder catheterization. It's still a tube, still going up where nothing should, and it's still done manually, in merely the same way it was introduced in the 1800s. Minus the boiled goose feathers they used back then. So yeah, some medical practices have come a long way. Others, still stuck somewhere between practical and medieval punishment. So next time you visit a doctor, remember, history never really dies. It just wears scrubs. If you enjoyed this trip through horrifying hospital history, give the video a like, subscribe for more strange stories, and drop a comment below. Which of these would you least want to experience? Until next time, stay healthy. Or at least, stay out of the leech jar. One banana later.